I'd like to ask you a question about puberty blockers specifically, because I was on them for a several amount of years.
If you don't mind me asking, would you agree they're pretty savage pharmacological agents?
They've left me with permanent irreversible damage, so yes.
The obsession with puberty blockers is insane. How many times do we have to tell you no? Puberty blockers do not work.
This is Admiral Brian Christine, the Assistant Secretary for Health at the Department of Health and Human Services. Over the past decade, the number of children and adolescents who reject their biological sex has risen dramatically. Some analyses indicate trans-identifying teens nearly doubled from 2022 to 2023. These young people and their families are searching for answers to gender dysphoria. They deserve honesty, compassion, and the strongest evidence for the help that the medical profession can offer. And that is why the United States Department of Health and Human Services worked with 9 academics with professional backgrounds in medicine, bioethics, psychology, and philosophy to conduct the most comprehensive review to date of the standard of care for gender dysphoria in minors. The findings within the 400-page peer-reviewed report are clear. Sex-rejecting procedures such as puberty blockers, cross-sex hormones, and surgeries for children are dangerous.
They've said it. Finally, the United States government is saying it. Oh, why? Boy, do I have something to show you today. And you know, I and a lot of us here have been pushing back on this insanity of giving children a medication called puberty blockers and the fake trans insanity pushing against us, saying that we're transphobic or that it's not right and that kids know who they are and blah, 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 blah. Yet all the facts, look, if factual evidence showed me that puberty blockers, I don't know why I'm doing that, puberty blockers work, I'd be all for it, 110%. And like I have been honest with all of you before, because you know I'm honest, I used to think it was a great idea until I realized it's not a great idea. And so to all of you out there, if you're on the fence, you are allowed to change your mind. Okay, you're allowed to listen. I'm bringing you factual information here. I have nothing to hide from you, nor do I want a child to suffer. But in fact, you are making a child suffer when you give them puberty blockers. And the insane stuff that the trans community says is so disgusting and wrong. And in my opinion, it's just child abuse. So I want to continue finishing this particular thing right here because I think it's very important and it plays into what's happening is, and what I always say is, the pendulum keeps going back and forth. And who's in the middle of the pendulum? Children. Okay, so we're playing with children here. This administration does this, does all this insanity with the children. Now this administration is going to pull back and stop the insanity. But when if something happens and another administration gets back into office, it's going to pull it right back. What I don't understand why people just aren't hearing the facts or wanting to listen to the facts and have some weird notion that trans kids exist. They don't exist. Trans kids are made up by adults for lots of reasons, I believe. Okay, not just one reason, but lots of reasons. And it's actually sick and wrong. So with that, really, thank you so much for hitting that subscribe button, because we are growing, people, and you are making it happen. And I cannot bring these stories to you and to the world without your help. And so really, I think you do know how much I appreciate you, and I do. So subscribing to the channel, liking, and commenting. I really love reading the comments when I'm taking care of baby girl at 5:30 in the morning. I read the comments. So with that, let's move forward on this very important conversation and this very important video from the government.
They can cause infertility, a loss of sexual function, reduced bone density, metabolic and cognitive effects, and certainly surgical complications. They can scar kids, both physically and emotionally, for life, and they can do irreversible harm. I implore physicians and parents to read this report and protect children from fraudulent procedures. My message to parents and kids navigating a world mired in confusion and despair is very simple. The prior administration and my predecessor, Rachel Levine, manipulated and betrayed vulnerable families. The Trump administration has the wheel now, and we will never, never abandon you. We are committed to gold standard science, not a political agenda, and we are always guided by radical transparency. Today, we are releasing nearly 200 pages of independent peer reviews that confirm the accuracy and the integrity of our findings. Around the world, countries like the United Kingdom, Sweden, and Finland have already shifted course, emphasizing psychotherapy and mental health support for children confused about their sex, and it is long time that we do the same in the United States.
Before we move forward, I really think this is so important because they are telling you factual information here. And Rachel Levine, who is a trans woman, okay, who has no understanding of the factual, doesn't want the facts, does not. And I have a video here that's really profound and I'm going to show you. Rachel Levine did not care about these kids. Rachel Levine cared about Rachel Levine, okay? And Rachel Levine implemented all of these false, fraudulent, great word, fraudulent spaces for trans healthcare where children were being completely destroyed. And I don't even know at this point how many hospitals, but at least 5 of them, including the one here in Los Angeles, giving children puberty blockers. And just wait till the end because I'm going to show you something very profound. These people think this stuff is just candy and you can literally, he said it right there, irreversible damage to children. We're not talking about adults. When you choose to take hormones like me and the stuff that's done to my body, I take full responsibility for that. I don't blame anybody. It is not anybody's fault. It's my own, fault for taking something that I really didn't know was going to happen to my body. I continue to take it, but it's my choice to take it. And I take full responsibility for any health problems that arise from that. But you're telling me that a 10-year-old, a 9-year-old's puberty blockers, and I do think they've given younger than that. That Rachel Levine, that's a whole other video I should do.
And this is not about politics. It's about science, it's about safety, and it's about trust. Our mission is to ensure every American, and especially every child, receives medical care that is evidence-based, that is ethical, and worthy of the public's confidence. Protecting our children's health and their future is good medicine. And it's also our moral obligation, and in the administration, we take this obligation very, very seriously. At the Department of Health and Human Services, we will continue to be guided by gold standard science, a dedication to radical transparency, and always the truth. That is our commitment to the American people, and it's my promise, my pledge to you as the Assistant Secretary for Health. Blessings upon you, upon your children, and upon our republic. Thank you.
How is this even a conversation? We're talking about children, people. The fact, I mean, I laugh because I just get so upset that we're talking about children's health, children's long-term health. It's mind-blowing. I know I say the same thing over and over, but how can I not be blown away? How can you not be blown away that this is happening? So the second video I have, I think is really important because this is Rand Paul questioning Dr. Rachel Levine before they were elected into office. So listen to this. This is actually really a great video that I found.
Genital mutilation has been condemned by the WHO, the United Nations Children's Fund, the United Nations Population Fund. According to the WHO, genital mutilation is recognized internationally as a violation of human rights. Genital mutilation is considered particularly egregious because, as the WHO notes, it is nearly always carried out on minors and is a violation of the rights of children. Most genital mutilation is not typically performed by force, but as WHO notes that by social convention, social norm, the social pressure to conform, to do what others do and have been doing, as well as the need to be accepted socially and the fear of being rejected by the community. American culture is now normalizing the idea that minors can be given hormones to prevent their biological development of their secondary sexual characteristics. Dr. Levine, you have supported both allowing minors to be given hormone blockers to prevent them from going through puberty, as well as surgical destruction of a minor's genitalia. Like surgical mutilation, hormonal interruption of puberty can permanently alter and prevent secondary sexual characteristics. The American College of Pediatricians reports that 80 to 95% of prepubertal children with gender dysphoria will experience resolution by late adolescence if not exposed to medical intervention and social affirmation. Dr. Levine, do you believe that minors are capable of making such a life-changing decision as changing one's sex?
Well, Senator, thank you for your interest in this question. Transgender medicine is a very complex and nuanced field with robust research and standards of care that have been developed. And if I am fortunate enough to be confirmed as the Assistant Secretary of Health, I would look forward to working with you and your office and coming to your office and discussing the particulars of the standards of care for transgender medicine.
The specific question was about minors. Let's be a little more specific since you evaded the question. Do you support the government intervening to override the parent's consent to give a child puberty blockers, cross-sex hormones, and/or amputation surgery of breasts and genitalia? You have said that you're willing to accelerate the protocols for street kids. Wow. I'm alarmed that poor kids with no parents who are homeless and distraught, you would just go through this and allow that to happen to a minor. I would hope that you would have compassion for Kira Bell, who's a 23-year-old girl who was confused with her identity. At 14, she read on the internet about something about transsexual. She thought, well, maybe that's what I am. She ended up getting these puberty blockers, cross-sex hormones. She had her breasts amputated. But here's what ultimately she says now. And this is a very insightful decision from someone who made a mistake but was led to believe this was a good thing by the medical community. I made a brash decision as a teenager, as a lot of teenagers.
This Kira is a friend of mine, by the way, and one of the first very outspoken detransitioned female to male back to female. And it's just I think this video is like 4 years ago, and it's still the same nonsense that's happening, if not amplified. Okay, so the words he's using are true. On some level, we are doing mutilation to young people. Again, a child cannot consent to having their breasts removed or having some form of genital surgery. And don't you dare say they're not getting genital surgery. What's her name? Jazz Jennings. And we all use her as an example, but there's others. I interviewed two minor people who, well, they're adults now, but when they were minors, they got genital surgeries, okay? Even if they're 16, they're still a minor, okay? So they are doing this to minor children who then regret it. And then what do you do when you don't have a penis or a vagina anymore?
Rash decision as a teenager, as a lot of teenagers do, trying to find confidence and happiness. Except now the rest of my life will be negatively affected, she said, adding that the medicalized gender transitioning was a very temporary, superficial fix for a very complex identity issue.
That's right.
What I'm alarmed at is that you're not willing to say absolutely minors shouldn't be making decisions to amputate their breast or to amputate their genitalia. For most of our history, we have believed that minors don't have full rights and that parents need to be involved. So I'm alarmed that you won't say with certainty that minors should not have the ability to make the decision to take hormones that will affect them for the rest of their life. Will you make a more firm decision on whether or not minors should be involved in these decisions?
Senator, transgender medicine is a very complex and nuanced field, and if confirmed to the position of Assistant Secretary of Health, I would certainly be pleased to come to your office and talk with you and your staff about the standards of care and the complexity of this field.
Oh, wow. The same answer, and the same answer, and the same answer. That sounds to me like you're evading the question. Dr. Rachel Levine, a shit show in itself. Okay, that person is disgusting. Now we're having to clean up the mess that this person, okay, brought into the trans medicine space. Will this person be held liable for all the children that have been hurt by the use of puberty blockers off-label, who should never have been? These kids don't have precocious. You trans community keep saying, well, 6 kids with precocious puberty have it. It was been used for a very small, very, very small group of young people, which I actually disagree should have ever even been used on those kids, okay? Because I have a video here. I have an actual video here that's going to show you exactly what I'm trying to tell you here. So Here, let me show you this, because this just came out, and this is really plays into all of this, okay?
Now, clinical trials of puberty-blocking drugs for children have been approved for the first time since their use in gender clinics was banned last year. It follows a...
For the first time. Clinical trials have been okayed for the first time. What? So you were giving puberty blockers without trials before? I'm a little bit confused. Secondly, the UK is now doing clinical trials with puberty blockers. Whose kids? Whose kids are in these? You have to have kids, to do these trials. So somebody's children are being used in these trials. Sorry, here, let me keep going.
A major review that raised concerns that the evidence for use of hormone treatments in children was built on shaky foundations. Now, before December 2020, blockers were available to young people through NHS Gender Identity Development Service at the Tavistock and Portman NHS Foundation Trust. Then in December of 2020, the High Court ruled that kids under 16 were unlikely to be able to give informed consent, and that led to caution in their prescription. Then in March 2024, NHS England announced that it would no longer routinely prescribe puberty blockers for new patients under 18. They pointed to insufficient evidence on their safety and effectiveness based on a review by NICE and interim advice from the CAS review.
The CAS review. So from 2020 to 2024, they were giving puberty blockers out with actually no really basis to give them out. What clinical reviews were being used to give them out? And as far as I can understand here, there wasn't any, and there was no evidence this worked. So already they were doing sort of experiments on children. You and I both know, okay? And there it is again, the CAS review. They did do a review. They did a review with a very prominent pediatrician, okay? Dr. Cass. And it came out, nope, sorry, doesn't work. But would the trans community take no for an answer? No way. So they still are underground doing, they do it. Somehow these people are getting puberty blockers. I don't know how. Dr. Helen Weberly, okay? Watch that. We're going to talk about this one again real soon, because this one's been all over the media and is still pushing the puberty blockers. I have some people doing some really good research for me on this one. So
then in May of last year, the UK government introduced emergency legislation to temporarily ban private and overseas prescriptions of puberty blockers for new patients under 18. That came into force the following month.
So see, they even banned private. So they were trying to do private, not through the NHS. They were opening clinics, okay, Gender GP, where you could get them from another country and shipped in. You see what they were doing? They were going around the government. But now that's been shut down, and Weberly is now opening that same clinic in our country to mess with our kids.
And then in December of last year, the temporary ban was made indefinite across the UK.
So see that? See that right there? So now they're going to do a clinical trial. They're going to try to figure out, like, do puberty blockers work? Like, why didn't you do that before you started giving the kids the puberty blockers? Why all of a sudden now are you doing all these clinical trials, or this clinical trial? It's so creepy. This whole thing is so effing creepy. So now what I want to bring up is a couple of these videos that I found showing the trans activist side, and then the side of people that actually know what they're talking about. Okay, so here's a trans activist talking about puberty blockers and why they should be used, and why cis people don't understand anything about puberty blockers, but these young trans people do. Okay, watch this.
This is like why it's so disingenuous to talk about puberty blockers as being like really dangerous for kids. It's like, who do you think this was invented for?
Yeah.
It was invented for cis children with precocious puberty, which is like early onset puberty, people who are like maybe going through puberty at like 7, 8 years old.
Yeah, like
or
girls
something like
getting
that.
their period in like second grade.
And so the idea is to just like hit pause on their puberty so that they can kind of go into it more with their age cohort, right? It's like, oh, well, is it reversible? It's like, well, if you stop, I mean, is it reversible for cis kids? Like, you just stop taking it.
I know more cis men on testosterone than I do fellow trans masculine people, whatever, on testosterone.
Well, because the testosterone was invented for cis people.
Yeah.
I mean, and same with estrogen.
Oh my God, these people are actually They're actually testosterone wasn't invented for cis men. It is cis men, you dumbass. Number one. Number two, it's always been for cis men. I hate, why am I even saying cis? I'm using their language, okay? What are you talking about? Secondly, puberty blockers are actually used off-label. They were not invented for that. They were invented for something else, which I'm going to show you now. They started using it with precocious puberty. It's still an experiment. Are you going to listen to people that are like that? Or are you going to listen to people who've actually taken the drug and has destroyed their lives? So listen to this. Testosterone was invented for cis people. What? It's literally what a man is. A man is testosterone. A woman is estrogen. We have both, but men have a small amount of estrogen and women have a small amount of testosterone. Now, we know there's always people in the middle, so don't even go there. But we're talking like pretty blanket statements here, okay? So this is the insanity of these people. They don't even know what they're talking about. But this is a really good one I found.
I'd like to ask you a question about puberty blockers specifically, because I was on them for a several amount of years.
If you don't mind me asking, would you agree they're pretty savage pharmacological agents?
They've left me with permanent irreversible damage, so yes, they are.
Yeah. Well, God bless you. We need more people to speak out against it. I mean, you take one puberty blocker, for example, which it's an off-label use, Lupron.
I was on that.
You were on Lupron.
Mm-hmm.
Okay, so do you know what Lupron is used for usually?
Chemical castration. It's used for prostate cancer.
Yes.
It's used for off-label for endometriosis, and it was used for precocious puberty, which is what I had.
Yes, and the first one that you mentioned, rapists used to be given Lupron, and the ACLU and left-wing groups came in and said it's inhumane to give people that are rapists Lupron. What would your message be then to the world where they say, but it's the loving thing to give a 13-year-old Lupron?
It will ruin your life. Period. Point blank. Leave you permanently infertile. It is terrible.
God bless you. And you have a community here of people that support you, and thank you for speaking out. We're going to have a generation of, no exaggeration, anywhere between 500,000 to 1 million young women 10 years from now that will say, what do you mean I can't have kids? What do you mean? Can I go back? It is irreversible damage.
First off, it just actually makes me sad to see Charlie Kirk there. But secondly, I mean, there you go. Straight from the mouth of the person who's been on it, as opposed to those people on their podcast, okay? Those trans queer people talking nonsense. That's not what it was invented for, okay? I think in the beginning, and I could be wrong, put it in the comments, but it's like it's a cancer drug. It is used for sexual assault people. And what a great comment he made, saying that, you know, they say it's inhumane to give to people who sexually assault people, okay, but it's okay to give to children. The hypocrisy and the insanity of these people. You think it's okay to give to kids, but you don't think it's okay to give to some psychopathic dude who's going around molesting and raping people. Like, what? Where's the logic in that? You idiots. Okay, here's another one. Pro-puberty blockers, rhetoric.
Are puberty blockers safe for kids? Do they cause dangerous, irreversible changes? And why are politicians so obsessed with them? This is Extra Explains Puberty Blockers. You see these medications? They're called puberty blockers, or gonadotropin-releasing hormone analogs. They temporarily freeze puberty, giving young people more time to figure out their identity before any permanent changes happen. Think about a young person as like a lump of clay. When the clay is wet, you can still explore its shape and put it into a bunch of forms, but once it sets, it's much harder to change. Puberty blockers pause this sculpting process, allowing time for exploration before making a permanent commitment. And a lot of politicians are out there shouting about irreversible damages, but blockers actually do the opposite. They prevent permanent changes. And if a young person decides to stop, puberty resumes and the clay starts forming again. In Canada, puberty blocker use has been endorsed by the Canadian Pediatric Society, among many medical organizations, as a key treatment for gender dysphoria for young people just starting puberty. Their effects are also reversible. if a young person decides they want to go through the puberty of their assigned sex at birth. Canadian Pediatric Society officially says that, quote, endogenous sex steroid production and or effects will resume if hormone blockers are discontinued.
I am just totally blown away that this misinformation is put out there like this. Like, first off, do you notice the cheeriness of it all and the little kid stuff and pop with the little, and making it very inviting, very, here, try the crack, little kid. Here's some little candy for you. It's very inviting. So if a young person is watching this and wanting to think that taking puberty blockers is okay, you don't think this is leading them into thinking, oh no, it's perfectly fine. It's completely reversible. It's like, I'm a clay body and I just don't want my boobs to grow. So but are they talking about anything? And who cares that the Canadian pediatrics and the Canadian idiots all say it's okay? Who cares? That doesn't make it true. We know that many of these organizations have been captured by this rhetoric and this nonsense. But I wanted to show you this because it's really disgusting. The way they lure you into thinking it's all fun and games until it's not. And then when it's not, what happens? They don't want to acknowledge that it's not. They will never acknowledge detransitioners. They will never acknowledge people who have been hurt by it. They act as if it's only 1%, even if it is only 1%, which is a lot. Even if it's 0.1%, it's still, who's that 1%? So that's the thing that bothers me a lot about the rhetoric, is that they're just acting as if it's straight up good. Okay? Straight up nothing wrong with it. Straight up okay. That's bullshit. Every drug has a side effect. Every operation has a side effect. But how dare you talk about there's no any long-term side effects? Never do you hear them say there are long-term, you could take it, it could help you for this amount of time. But we don't actually know what they never, ever, ever say that. And on drug commercials, when you're watching on TV and then a drug commercial comes up and then it goes, and the side effects can include suicidal tendencies, nausea, vomiting, shitting your pants in the middle of the post office, blah, 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 blah. You know how it says all that? How come they never say that? And then now the opposite side from an actual doctor, okay, who's going to tell you the real facts here.
This is why puberty blockers pose grave risk to developing children.
Children who believed they were the opposite sex, or one of the kind of made up sexes in between, and then plugging them into the clinic where they would get started on puberty blockers at Tanner stage 2, which is before the onset of pubertal development, right? Before the onset of secondary sexual characteristics like breasts or pubic hair growth, and then
So
after
just to
that.
be clear, how old were these children that they would be putting the puberty blockers, giving the puberty blockers to?
11 years old was the youngest I've seen.
Wow.
And important to know that these blockers are just as severe, if not more severe, than the most radical surgeries, because it's like having 1 million microsurgeries on every single cell in your body. And they do it, the effects these hormones and medications have is to change almost every single natural physiological structure in your body, because there's no surgery in the world that can deprive your brain of the hormones necessary to become an adult, or make your bones as brittle as like an old woman.
Wow.
And that's what they're doing to these kids starting at the age of 11 years old.
So just to be clear for folks listening, what are the consequences, the potential risks of starting to take puberty blockers at 11 years old?
A good way to initially put it is, so these are the same medications they use for advanced prostate cancer, Lupron, right? Because it castrates the hormones from an individual's body, right? It shuts the whole system off. And a lot of these older men can't tolerate it because they have such severe mental responses to it. They get depressed, they lose all of their energy, they go into menopause, they have hot flashes. They can only do it for a couple of months before they can't tolerate it. And they're doing this kids who are 11 years old. But it's more than that when you do it to a kid, because what happens is they essentially do not go through puberty. So number one, most importantly, you will sterilize them because you don't undergo the exposure to the hormones that allow the maturation from immature sperm to mature sperm, or immature eggs to mature eggs. So if you never undergo that process, you never develop the cellular architecture necessary for fertilization, right? And then you can also develop, like in boys, a permanent micropenis, like in the case of Jazz Jennings, right? Because his puberty was blocked, he never underwent the growth of his sexual organs.
So this is really important. That conversation is important. Why is it important? Because how can an 11-year-old, right, say, okay, I'm fine with losing all my sexual ability. I don't want to have kids. Fast forward now to, I see so many trans men getting pregnant. Imagine if they were, and they're all about, they call themselves seahorse dads. Whatever, that's your thing. I don't really give a shit. Well, I kind of do, because I'm concerned more with the child's health. When you're on hormones and you're making a baby, like, how does that affect the baby? So that being said, though, what about all those guys? What if they would have been put on puberty blockers and they never would have ever had the chance to have babies? Okay, so how come you're not talking about that? So no child can consent to never having the ability to have a child or have sexual feelings. That's one of the things Jazz Jennings even says, that they don't have feelings. I've interviewed young people who have been on puberty blockers, and they've even told me that, no, they don't have any feeling, they have like zero feelings towards people. Can you imagine not having any kind of they don't have attraction, they don't feel sexual? What? That is a human right, by the way. That is a human right to make a baby if you want to, and to also have sexual feelings towards people. There is something bigger going on with this whole thing. There is just, but I'm going to sound like a conspiracy wingnut if I really start to talk about what I really feel about this whole sick-ass experiment on children. The last thing I'm going to bring you, you've seen it before because I play it a lot, because I think it's a very profound interview of Johnny, and I did a video on him a little while ago. He was put on puberty blockers, I think, at the age of 13. Destroyed him. He's like 23 now. So, go fuck yourself to the people out there who are trying to do this to kids, because this is disgusting. And this is what's going to happen when you decide that you know better than anyone else, okay? And that you decide that you are going to say, yes, children should be put on this stuff.
When I was on the hormones, and specifically the blocker, I was having terrible muscle spasms, muscle atrophy, and she had mentioned I had started peeing blood. I did start peeing blood for that time. I was developing spontaneous ulcers in my bladder with no pathology present, so they didn't know why they were forming. I had also started having issues with sexual dysfunction at the time, like many intimate dysfunctions, breast pain and fluid leakage. I used to leak so much fluid that I would have like circles on the outside of my shirts. None of this was addressed by the doctors at U of M. Whenever I bring it up to them, they'd be like, that's just a normal part of womanhood. So I never got addressed at U of M. I had a surgery done at Corewell for the biopsy and that ulcer in my bladder. And around that time, Mom had gotten so freaked out about this stuff that she did fight to get my blocker taken out.
Oh, I know. I just don't even know what to say. Why are we not hearing these young people, the actual people who are put on these drugs, as if they're just being cast aside because you don't want to hear what they're saying? This child's, okay, he's 23 now. He's still a child. His life is ruined, fucking ruined. Because you people out there think you know what the fuck you're talking about. You are scamming the system. You are crazy if you think a child is trans. You are making it up. You are making kids trans. You don't care about these kids. All kids struggle on some level or not, okay? All kids. I don't care. There's no such thing as not struggling. You go through puberty. You go through some stuff. It's hard to be a kid. It's not fucking easy. We were all there. All of us have been there. I am so over it. I'm so mad. I am so disgusted. The fact that we are letting a doctor come from the UK and open up a clinic in our country to continue to give this disgusting medicine to the children of the United States has to be stopped immediately. It is illegal. There is no way it is a legal thing that woman is doing. And we're going to find the loophole. And we're going to make sure that gets shut down before it can even start to spin out. And shame on all, okay? Shame on all the insurance companies who are participating in this. Shame on all the doctors. Shame on all the psychiatrists, the therapists, anybody who is on board with transitioning young kids. Shame on you. And it's going to come back to bite you tenfold. I'll make sure of it. Okay, so with that, I hope you all have a great day. Seriously, like, no, just no. Okay, baby girl is literally, I'm seeing this. Okay, I can't even imagine. Baby girl's relying on me to make sure that the future for her is badass and she can be a badass. And again, like I said, when she grows up a bit and old enough and she wants to be a funky non-binary whatever, you go right ahead, kiddo. I don't have anything to do with that. But until she's old enough to figure that out, she's under my care. And my care means that she doesn't, the last thing I want to give my kid is drugs. That's what I don't understand. Why do you want to give your kid drugs? Why do you even want to do that? Shouldn't you think about another way to get around that? These people are gaslighting parents into believing their children are trans. It's sick. So baby girl says hi. The 13-year-old says hi. And I just want to thank you all again for hitting the subscribe button and helping this channel grow, because, wow, I'm kind of blown away. I have some really good news coming up. And with that, my life is amazing. Thank you all so much for listening, and I appreciate it so much. And I hope you all have a great, great rest of your day.